Hello, this video lecture is going to address important study tips and just some ideas for staying organized in this online course. And I'm going to review the PowerPoint that is uploaded to our Canvas site that is called Important Study Tips for Academic Success. So the first thing I recommend is that you just try to get organized. So you need to find some type of way to keep track of assignment due dates, whether that's by writing them in a paper planner or by adding them as appointments to your calendar in your phone. Another method that I've used is I've printed out the syllabus and schedule, and I've written on the schedule portion the due dates for each assignment. You also need to give yourself plenty of time to review the module resources, such as the assigned reading, the PowerPoint, and the videos, as well as the video lectures. It's just going to take some time for you to review all of that information, so please don't wait until the last minute. You also need to schedule time to specifically study the information, and we'll talk about that in more detail here shortly. Also, I recommend that you plan ahead. Sometimes the unexpected happens, such as, your computer might stop working, and it's important to not wait until the last minute to do assignments so that you will not be submitting your assignments late and can make alternate plans. So definitely plan ahead. Also, frequently check the course site and emails. I will communicate by email with you as well as in announcements in our Canvas site. So it's important for you to check there frequently so that you will know what's going on in the course. Also, please try to stay connected with me and with the other learners. It's important for you to, be part of our online learning community so that you don't miss important information. And then, as always, don't hesitate to ask questions. There is going to be a Muddiest Point discussion board in our course where you can post questions just about information or content that is unclear. I will be checking that frequently. And then also, if you have a more personal question, please don't hesitate to email me directly. So the preliminary work that you'll be doing in each module is first you'll just want to review all of the resources in that module. Then you'll want to complete assigned reading, watch the videos that are posted for that module, review the PowerPoints, and then also watch the lecture videos. I highly recommend that you take notes from the lecture videos. Essentially, I will be reviewing the PowerPoints in more detail during the lecture videos, so you should even consider printing the PowerPoint and taking notes on that. And then you'll also need to complete an interactive Nearpod lesson for each module that will help you to kind of interact with the content and to learn that information. So become more familiar with the content. So we talked about studying. You'll want to study the PowerPoint, your notes, and the other course resources such as the videos and the video lectures. We will talk about studying in more detail on the next slide. Also, please refer to your textbooks and the other course resources to clarify any information that's unclear. And then also, reach out to me, whether it's in the Muddiest Point discussion board or by email, for any questions about unclear information. I highly recommend that you practice several NCLEX style questions regularly. So really you should be shooting for 20 questions daily or more. And then in addition to that, a 50 question quiz weekly. There are many apps that can help you practice these questions. Some of them are free, some are paid. It's up to you, what app you want to use. But if you practice NCLEX style questions, especially that have rationales for the correct and incorrect answers that will help you when it comes time for you to take the NCLEX RN licensing exam. And then, as I said earlier, any unclear information, please don't hesitate to post about that or to email me about that. All right, how to study. So first of all, if you don't know what type of learner you are, I would start there. You can complete the VARK questionnaire, which I have linked it to the PowerPoint, this PowerPoint that I'm reviewing now. So if you open the PowerPoint in our Canvas site and click on that link, you can download the VARK questionnaire and answer those questions. Once you answer all of the questions, it will tell you how to calculate your score, and it will essentially tell you what type of learner you are, whether it's a visual learner or an auditory learner, or if you learn best by writing things. So once you know that, you can then locate some resources that will help you to learn better according to your learning style. So if I were to complete the VARK questionnaire and determine that I'm a visual learner, then I would probably then Google resources and study tools for visual learner, and it would give me lots of resources and websites related to that. Also, don't wait until the last minute to study the content. I recommend that you start early and try to learn the content, and that you also space out your studying intervals. Instead of trying to study for 8 hours all in one day at the last minute, you want to, schedule your study time to be spaced out through the week. So maybe 3 days a week or 4 days a week, whatever it looks like for you, for 2 to 3 hours at a time, because essentially once you get past that 3-ish hour mark, you're really going to reach a content saturation, and you won't really be learning the information very well. And then also, you're really expected to study at least 2 hours per week for each course credit hour to be successful in that course. So just to think about what your study time should look like. Okay, so once you've studied the information and you have, and you feel pretty good about it, like you know the information, you need to really test yourself to see if you really do know that content. And here's what I recommend that you do, is you put all of your information away, like your notes and your PowerPoint, and you get out a blank piece of paper and a pen or pencil, and you kind of play a game called Now This Is My Patient. So if you studied about pneumonia, then you're going to get out a blank notebook paper, and at the top you're going to write pneumonia, and you're going to think, okay, now I'm taking care of a patient with pneumonia. What do I think this patient is going to look like? And so then you'll put clinical manifestations. I think he's going to be short of breath. I think he will probably have fever. He's going to probably be coughing up sputum that may be yellow. And think about all of the clinical manifestations. And then after that, think about, okay, what diagnostic tests do I think are appropriate for this client? Okay, I think he probably needs some lab work like a CBC so that we can check his white blood cell count, because if it's elevated, then that would indicate that he has an infection. I think he needs a chest x-ray to see if that indicates that he has pneumonia. So go through all those diagnostics and then go through what medications are a priority for this client and what nursing interventions are a priority for a client with pneumonia. So that's how you would check to see if you know the information. And once you feel like you've gotten everything written down on your paper, then you get your notes back out in your PowerPoint and your book, and you look to see, oh, how well did I really do? And that will help you to find your gaps and to study those areas more intensely. Another way to determine if you know the information is to try to teach the information to others. So if you have a significant other or a spouse, you can ask them if they mind if you teach them about pneumonia, and then you go ahead and do that. And if you're able to teach all those different areas, then you probably have a pretty good grasp on that content. Another idea is to join a study group, and in an online course, there's lots of different methods for joining a study group. It might most look like meeting virtually using some type of video conferencing tool like Skype or Zoom to meet regularly. It is important to choose your study mates wisely because often a study session can really turn into more of a social time. So that's another idea, is to join a study group. We talked about using the NCLEX style questions. If you can find NCLEX style questions that are specific to the content that we're learning in this course, then that will help you even that much more. And then try to find some time to relax. And I know that's easier said than done sometimes, but just trying to find some downtime every now and then and some time for yourself will help you to stay focused and to avoid burnout. So then after you've learned the content, you will need to complete the assignments. So just be sure that you closely review the instructions and also the grading rubrics for the assignments, because that will tell you what you need to be doing specifically, and also how am I going to grade your work on that assignment. You should use your course resources to help you complete the assignments, and also give yourself plenty of time and plan ahead to complete the assignments. Don't wait until the last minute. We talked about, unexpected things happening, like if your power goes out and you lose internet. And then before you submit your work, I recommend that you just double check it to make sure that everything is the way that you want it to be, and that you've checked the rubric and instructions while double checking your work. And then also, for any questions or concerns about assignments, please reach out to me. So, study tools. Flashcards, concept maps, and mind maps. I am a fan of all of those as study tools. Flashcards in particular are good tools for medications as well as lab values. And what it would look like for me is I would probably write the name of a medication or the lab test on the front, and then I'd put the details on the back, and then that way I can use those to quiz myself. Concept maps, I'm a huge fan of those. So that's really where you would create a concept map relating to one content area. So these on the screen are related to diabetes, and then there's one about hepatitis. You can really make these look like whatever you want them to look like. So for me, let's say I were creating that concept map about pneumonia, I would probably put pneumonia in the middle and circle it, and then I might branch off to the side, clinical manifestations. Okay, I think, short of breath is what our book says in the PowerPoint. Fever, productive cough. I'd list all the clinical manifestations, and I'd arrange everything around that, around the pneumonia that's in the middle, and I'd even include medications and diagnostic tests. So that is really going to help you to make connections with the content and to learn the content. And then once you've created those concept maps, those are really good tools to help you to study that content. Here's a video about concept maps and how to create those. So if you're interested in making concept maps, you can watch this video, which is embedded in the PowerPoint. And then mind maps are really concept maps, but one step further, they have images in them. So if you like to draw or you're artistic, you can create mind maps and include some images. Or if you're like me and you really can't draw very well, you might go to the internet and print off a diagram of the lungs and paste that onto your paper and maybe take notes around it. But that's what a mind map is. And then here's a video also embedded into the PowerPoint about how to create mind maps. And then these are all of the references for the sources of information and some of the images that I used in this presentation. So thank you for watching.